While we're waiting on the others to come in, if you would go ahead and place your name and campus back in the chat. All right, so if you would come on back on camera, go ahead and turn your cameras on. Ensure that you place your name and your campus in the chat. Place your name and campus in the chat. And it's just a reminder, these sessions are recorded and they are viewed by the attendance administrator. So in the event that you have to be away from the camera, please place a message in the chat to myself. Don't send it out to everyone, just send it out to me. So so you, as usual, the last exam is taken on Friday afternoon around, I think, 2 o'clock. But just like it was for exam one, the last class has to take the exam, and then we do an exam and analysis, and then we will post a grade. But you'll get that alert when all those things actually take place. So again, we have to wait until that last class finish taking the exam. Then we have to do the exam analysis, and then we will post a grade. So we'll got a little time we have to wait, but that's just how it is. So let's go ahead and start. I know we haven't taken a break yet, but we want to go ahead and get started on our content for this week. So remember, let me just share my screen here so you can see where we're at and where we're going. We are halfway there because we're week 6. So get these others in here. You know. So then after we post the exam scores on Friday, it is week 6. So we'll turn on homework scores so that you can see the impact of homework scores. But remember that, your key graded assignments, that score has to be a 78, at least a 78% outright without rounding, not 77.9, not 77 point whatever. Has to be outright at least 78% without rounding. But we do turn on the homework scores so that you can see the impact of homework. And then we let them stay on for like a week or so, and then we turn them back off. So just know that. Let's see here. For those of you that are just coming back in, go ahead and put your name and campus back in the chat. Ensure that your first and your last name appears on the screen as it appears on Fortis's roster. And as always, remember these sessions are recorded. Let me share my screen here with you all. If you're having any issues, connectivity issues, please let me know. Put it in the chat so we can, have it documented. If you get knocked off, just log back in, send a message. If I get knocked off, just stay right there. I'll log back in on a different device. Okay, let's see. We're at week 6 here. So we do have some case studies here that will lead us into our next. We had exam 2 today. So we will start, we'll do some case studies, which I've sent one of them to your email already, but don't look at it just yet. It's going to lead us into where we're going. So next week, we're going to start looking at the healthcare system, like how are all those services and things that our patients receive, how is it paid for? How is that governed? What does that financial piece look like? Then you have a few activities. Then we have week 7, and we have week 8. We have some more content. We're gonna start looking more at the evidence base. What is the latest evidence, information that guides what we do. And then we have our next exam in week 9. So we meet, we start content this week, and then we meet 2 weeks, and then that last exam is in week 9. And then, of course, you have your project that's due in week 10, and then, all HESIs are week 11. So start thinking about, remember, if you need that exam proctor, be thinking about your schedule, all the things that you're responsible for. Start thinking ahead. I know it's early. You still have 2 weeks, but just start thinking about it, because if you need it proctor, you have to submit that communication requesting that, it be proctored to your campus dean, Dean Brown, and myself, with your reason. And we will have to have a date and time and a place to find, for you in order to have that exam administered. All right, so let's go ahead. I sent a case study. I think I sent 3 slides to your email in your Canvas mail. So if you would pull that up, we're going to just start the conversation here. We have about 15 minutes before we go into our first break. So we can start the conversation on it. Let me pull it up here. The body of the message just says, see the attached. So I'm going to share my screen. I'm going to read through the case study. Then we're going to take a moment and let you all talk through it in groups. And then we're going to come back whole group and share out.
I don't see it in my email nor Canvas.
I don't either.
I don't see it either.
Okay, well, I'm going to share my screen. We're going to read through the first slide, and then I'll look back at it and see if it went out here. Let's look here. So as we read through the scenario, just be thinking about everything. Pull med surge back up, OB. I don't know. Just think about all those things, all that information that you know.
Hey, Dr. Morton Ford, you said you sent it in a message on our Canvas, correct?
Yes.
I'm not seeing mine.
Yes, that's what. Thank you for letting me know that, and I'm rechecking on it.
Okay.
Yes, so we're gonna resend it to you again. So be thinking about, and I'm gonna share my screen here too as well. Be thinking about all your prior knowledge as we read through this scenario. Share my screen here. There we go. And let me do the slideshow for my current slide here. So, can I have a volunteer to just read through the first paragraph and just be thinking about what it possibly could be? Interventions, just think about everything from A to Z with our care. You know, with the head to toe assessment, how we would ask those questions, and then we go into those focus questions, depending on what they answer. So, someone read this first paragraph here, these first couple of sentences.
Mr. Ramirez is a 52-year-old male, married with 2 teenage children. He is a part-time construction worker without any health care benefits. He speaks limited English with his primary language is Spanish.
Okay, so be thinking about all those pieces, like how old is he, male or female? You know, is it important that we know that this patient is married and have children? Is that important in taking care of the patient? Is it important to know their occupation? Does that even matter? Does it matter that we know that they have limited English and their primary language is Spanish? So be thinking about, is this important or not? And if it is, what things, what interventions? And we're gonna get to that part, but I just want you to start thinking. Good. Next person, read this next couple of sentences for us.
He presents to the emergency department complaining of chest pain that starts 2 hours ago while at work. He describes the pain as a tightness radiating to his left arm and jaw. He took 2 tablets of acetaminophen at home before coming to the hospital.
Okay, like I just did, I read through this right here, pulled out some things that we might need to be thinking about. So someone do this paragraph too. So tell us what things that might be important that we should consider as we come up with the interventions and we continue to take care of this patient.
Chest pain.
Chest pain. Is that it? Just chest
When
pain?
it started.
No,
when it started. Go ahead. What'd you say, Brenda?
It's radiating to his left arm.
Okay, so it started 2 hours ago. Then it radiates to the left arm. Go ahead.
The tightness and the fact that he took the acetaminophen.
Okay, he took 2 tablets of acetaminophen before coming. Took some Tylenol. Okay, someone read the next couple of sentences.
He delayed seeking care because he was worried about hospital costs and did not have health insurance. His wife eventually persuaded him to go to the ED when the pain worsened.
Okay, anything that we need to consider in here?
He's having a heart attack.
So anything that we need to consider? We ain't got to the diagnosis
He was
yet.
clearly worried about paying for it.
Okay.
The fact that the pain got worse.
Okay, got worse. Financial, he may be insured, maybe uninsured, or just not enough insurance, not at any at all, or just not have enough. So we have to, when we're taking care of a patient, yeah, we're going to get to that diagnosis, but we need to consider all those things that's going on with that patient, that holistic, so we can provide that holistic care for that person. Because sometimes if we don't consider that hospital cost is an issue, or we don't consider that this person's primary language is Spanish, what might we run into? What barrier we might run into with this patient?
Language barriers and just overall health and awareness for the patient.
Okay, so a patient might not understand what you're saying, might not understand that part, but what else? If they're more focused on the cost.
Teaching, it may be hard to teach.
Hard to teach because they don't understand what you're saying. If they're worried about that cost, and each time you come in the room with a pill or we need to do this test, what might that, we don't know yet, but what might that patient do if they're worried about the cost because they do not refuse. They may be non-compliant. Great. They might be non-compliant, not because they don't want to take care of themselves and get better, because in their minds, they know that this is going to turn in, each thing turns into a bill each time they hear that knock on the door. So again, that's why we need to consider all these things, not just the diagnosis that they might have, but we do. It's like we're considering all those things at once, and then we start to put things into priority. Okay, so let me stop sharing here. So check your Canvas mail. Let me know if you got it.
Yes.
Okay, so you got it. So what we're going to do is look at I'm going to put you in small groups here. Look at the assessment. So you have some, we should share my screen here. You have some more information on the patient. So you're going to look at the assessment and then think about what medical diagnosis this could be. List at least 2 or 3. And then start to talk about the plan of care. Just do some jot noting, just whatever comes to your mind at first. And then being more specific, what should the nurse consider when we're thinking about patient advocacy and incorporating, providing that culturally competent care? A discharge plan begins on admission. So what are those things that we need to be thinking about if this patient really does have whatever medical diagnosis, but nevertheless, what are those things that we do know? This patient, doesn't have any insurance. They delayed treatment. What are those things that we need to start thinking about here? So I'm going to put you in small groups, maybe 2 or 3 together, because we have about 5 minutes before we take our first break, and just start jotting down what comes to mind. But think back on your prior knowledge. And then I'll circulate through you stop sharing here, to the groups, and then just listen to what you're saying, and then we'll close, and then we'll go to our first break after. So give you 5 minutes. Let me open up the breakout rooms. Accept the invitation. Let's see here. Make sure no one's in there, but I can see this. Okay. Accept the invitation, and I'll come around and listen to what you're thinking about, what you're talking about. Do some jot noting, and then we'll come back and share it out after the break. Oh, Brenda, let me move you to a different group. Sorry. Let's see. 4. So what I can do. So accept the invitation and make co-host. Got it. Brenda, are you there? Looks like you're still in the main room. Are you logged in twice? Let's see. Brenda, are you there? Okay, there you go. So accept the invitation. Did it pop up for you?
It did, but it kicked me back out.
Okay, so let me see. I'll move you to a different. Let's see here. And let's see. Okay, see if it will let you go.
And he's worried about the cost. So that's gonna be like a infraction, like an infraction on the patient care, the overall care.
Should it affect a patient care? Whether or not that you said whether or not they have insurance? Is
Of
that what you
course
said?
not.
Okay.
No.
But what if you hear a provider, the speech therapist or the dietitian say, hey, they don't have insurance, so we're not going to offer them the options that we would offer anybody else? Is that okay?
Well, we can let them know that we can coordinate what is it called? Like the patient assistant
They provide financial assistance registration.
Yeah.
Give them information about financial assistance that they can utilize at a later time.
And
once
maybe we
after
can
their
get
hospital
it
stay.
and maybe we can get the papers that would be in Spanish so that he can see.
Ooh, sounds like y'all on the right road. Okay, I'm going to the other group. We have about 3 minutes before we stop and take our break. Keep going.
Tightness in his. He have a tightness in his. So me, from what I'm saying, I'm thinking he's having a heart attack.
Yeah, and then he has a regular heart rate, but his
Mm-hmm.
respiratory rate is high.
So
And
what
his
is a heart
function,
attack? What is that?
I know it's like blocking. I know it's like the blocking of the heart. Like I know it's not like TIA because this is not brief. Because
Let me
he
see
said it's
his
been going over
vitals.
2 hours.
His respiratory rate is irregular rate.
What's the
Dream.
other word for a heart attack? If it is, if it's a heart attack, what other word do they
Is
use?
it it's not the insomnia. I don't think that's it.
Oh,
That's not the
wait, it's at the
transmitting
tip of my tongue.
That's all
because
right.
it's
We'll
not,
get it. I'll be talking on to the
it's
other
not a
group.
TI that yeah, because it's
Not
not
a
a
No, no,
TIA because you're
no.
okay. I'm about to say
with the TIA is something different, but you all are saying he's actually probably having a
having
heart
a heart
attack.
attack.
So what are those? What's that other word? That medical term? If we're
Coronary.
talking to him, we would say, "Hey, your doctor says you've had a heart attack, or they diagnosed you with a heart attack." But more than likely,
Well,
on paper, we're going to see some other terms written. What would those terms be? Okay, what points? So what points have you all come up with? What's going on with this patient? What do you think?
Myocardial infarction.
Okay, and what is that? If you were talking to the patient, what would you say to him?
Heart attack.
Okay, so we speak in layman's terms, and then what pointed you toward that? What information, subjective, objective information, what subjective information led you to that? That could
The
be
chest pain radiating to the shoulder and arm,
okay.
Troponin level.
worsening.
Well, the elevated troponin.
And then objective was elevated troponin and blood pressure.
Yeah, that would the
Diaphoretic.
lab work would be objective chart obtained,
Mhm.
unless the patient stated, "Oh, they told me my troponins were, whatever the number were." Okay, good. What else?
On subjective or objective?
Subjective.
Yeah, but it was just the worsening tightness in the chest,
Okay, so it gave you some more information,
radiating down
further
the arm and
describing that.
jaw.
Yes, good. And that nurse may have asked once he said he had chest pain. They may have asked those focused questions. Well, can you describe how it feels? Anything make it better or worse? Getting that focused, detailed information, questions answered. Okay. All right.
Think the health promotion would be like teaching him about his
Exercise,
diet
dieting,
and
yeah,
exercising and stuff like that to help
managing
promote healthy habits for his heart.
and
What
managing.
specifically? What food items? If I go to the grocery store, he's saying, "Well, what should I buy? What
Low
should be on my
sodium.
list?"
Low sodium.
Yeah, low sodium.
Got it.
He could
Okay.
do the DASH diet.
What is that? For the most part, they're lay people. They don't know these things that we're talking about. So what would that be? What food
It
item?
would be like the low sodium, low carb. Is it low carb? Yeah. So we'll have like dependent, I know like in their culture they probably eat certain things. So we'll ask him like what he eats and then pick out the things that's good
Good. That's a
pertaining to his
good idea.
diet.
Teach
Good.
him.
Okay, everyone should be back in about 54 seconds. So we're gonna start talking as a whole group about the patients. Healthy. I didn't make it around to all the rooms, but the conversation was really, really thoughtful. Detailed. So once we get everybody back, let me share my screen here. Let's go back to our patient here. Let's see. Seconds, then we'll have everybody back. Okay, I think we have everyone back. So let me share my screen here. So we have subjective and objective information. So tell me, what is subjective information? Like, give me a definition.
What the patient tells you.
Okay. And then what is objective information?
What you see.
What you see.
Okay. Using 4 of those 5 senses. Is that boom, boom? Is that, that little dub that you hear when you're listening to the heart sounds, or when you see that first sound that you hear when you're checking the blood pressure? So from our assessment findings, what was abnormal subjectively? Looking at the information that we got from our patient, so someone tell us, what were those subjective things that were abnormal for our patient?
Chest
Chest pain.
The tightness.
Okay, so he said he had chest pain, and then I'm sure the nurse probably asked a focus question, because the patient did state that they had chest pain. So then he went and said they had tightness. Also said that chest pain did what? The tightness, and it radiated to that left arm and the jaw. What other subjective information do we have from the patient?
I'm taking the acetaminophen.
Okay. He took the Tylenol.
And the word about the hospital cost.
Okay. So let's look at objective information. Anything abnormal here?
Troponins.
The vital
blood pressure, his heart rate.
Vital signs, blood pressure, heart rate. So how do we know that the heart rate is abnormal?
We took his blood pressure.
The rate's irregular. Well, the rhythm's irregular and the rate is elevated.
So what is the normal rate for the heart rate?
60 to 100.
Exactly. Good. And where do we want the blood pressure to be close to?
120/80.
120/80. So that information that you go back to your foundational information. And that's as you look at each thing, as you hear the patient talk, as you're looking and looking at that non-facial grimacing or that facial grimacing, as you're looking at all of these key points of our patient, we put them into 1 or 2 categories. Okay, is this normal, abnormal? Then we go back to our foundation, what we know. What about this O2 saturation? Is that okay? Or should we be concerned?
That's low.
It's low.
It's low because the norm is that 95 to 100%. Good. What about the skin? What's the normal for skin?
It should be dry instead of diaphoretic, and not pale in color.
Got it. So yes, so that's going back to your foundation. So this was our assessment findings for our patient. So we looked at everything. So the first question is, what do we think? What's some medical diagnosis do you think this patient might have? What did you all come up with?
MI.
Heart attack.
One more term. Her MI, heart attack, and what else?
STEMI.
Okay. Let's look back at the ST elevated. Was it ST elevation? If they have to be specific about the heart attack, it's a non-ST elevation or ST elevated. Good. Okay. All right. So what are some things that we should be doing for this patient? What's the plan of care? What are some interventions? And to be more specific, we gave you some categories. We said, Mr. Ramirez expresses anxiety about the hospital bills and states, I can't afford this. I don't have insurance. Please don't do anything expensive. His wife is tearful and states that he avoided going to the doctor for years due to the cost. So the nurse should be thinking about some things as we decide the interventions that we're going to implement, what we're going to do for this client. So patient advocacy, what did you all have under that category?
We would just try to notify the patient that we could get a caseworker involved to help him apply for medical to help with the cost of the visit.
Okay. The cost of the visit, and what else? What else did you all have for patient advocacy? So is cost the only thing that we're going to advocate for? Is he going to need any care after this hospitalization, or will he more than likely just go back home? Or will this patient need rehab?
No, you're gonna also try to get him to possibly see a cardiologist
after the hospital visit, like get a referral for that. So that's
Mhm.
part of your advocacy too, is making sure that you're going to continue that care for the patient outside of the hospital setting.
Exactly. So you're going to advocate for not only the bills and the things that he's going to incur inside of the hospital, but once he leaves, if this patient needs to go to long-term care, will the long-term care facility accept this patient with them not having any insurance? And if that facility doesn't, can we identify another facility that will? And then once that patient goes home, will this patient incur any costs related to his illness? So we need to be seeking out resources that are in the community that can help this patient continue to rehab and also get back as close to the optimal level of care as it can, so that he can, be able to manage and live and, still be able to take care of himself and his family. Are there any cultural things that we need to be considering for this patient?
Dr. Ford, we
Interpreter.
also need yeah, exactly, an interpreter.
The interpreter, okay? And what else? When we are printing, for the most part, the documents that state, like the discharge plan, we come back and reinforce the discharge information. But what they have, you can select which language. For the most part, they do. And so it is important that we place information in that person's, dominant, main, first, however they want to word it, first language. Because if you're giving me something, my first language is German, and you're giving me something in Spanish, I would have a problem with that information that you're giving me. So make sure it is in whatever their first language. You may have to bring an interpreter in. You might even have to ask a family member. You might even have someone on staff that serves as a dual role, where they have I don't know how they do it, but they do have some people on staff that speaks multiple languages. And if that interpreter is needed, then their role changes. Their patients or delegated, or the their assignment for that shift might change because they're needing that nurse to be the interpreter. But that's good. Anything that we need to be considering with discharge planning, if in fact this patient has had a heart attack, a myocardial infarction, MI, what are some things that we need to be thinking about for discharge planning?
Medications.
Exactly. And case management, like a case manager probably to enroll for insurance.
Okay,
An
good. Okay.
aftercare plan with his diet and exercise.
Okay. There are some resources out there. Once he gets rehabbed and able to be back on his feet, where they can offer like a month's membership at the gym, or they may have not really, they have the gyms, like the main gyms, like the YMCA's, but then they have like community places that they can go, these wellness centers. We might want to get that person involved with that, because those wellness centers they have resources and programs that are specific, new diabetic persons had a heart attack, that are specific for them, so they can get them back as close to normal, and them being able to manage their own care and understand what it means to be able to manage their own care. We kind of started off in health promotion. What else did you all have for health promotion?
Just adherence to the regimen and medications.
So just advocating, making sure that the patient understands why these medications are needed, how they act, what do they do for the body. Okay, being compliant. One group was talking, and you might want to be quiet. Anything else for health promotion? Somebody mentioned having a conversation with the patient about which group was that? About what they eat?
Yeah, we would take into consideration like he is Hispanic, so he's going to have a different diet. So we would provide dietary changes for his culture.
Okay. They said, when I went to the group, they were saying, well, get the patient to let them know, the nurse knows, what does a typical lunch look like? What does a typical dinner look like? And then identify the food items in those meals that they may need to change to something else, especially if it's high salt content and high fat content.
Will he be considered of the DASH diet?
And what you all talked about that. Remember I asked that question, what is the DASH diet?
Like a low sodium, low fat diet.
Okay, okay. So that would be good. So, but make sure that we put it into terms that the patient can understand. So, like you
Right.
all said, give that example. Let the patient say, well, what do they normally eat? And then identify, well, hey, we might even have to do food labels. We can pull up food labels. They may even have some handouts or something on the unit where the patient can see, well, what we're talking about when we're saying sodium. You know, if you see this, right, sodium, this is what we're talking about. And if it has this amount, and you're eating this food item, this says that you consume all of your sodium for the day, which is this one food item. Because sometimes we don't realize, eating certain things is like, oh, I'm consuming that much of fat or carbohydrates or sodium. Good. All right. So any other information we want to give about this case study before we go on our break? Anything else that you all just wanted to say? Like I said, you all were having some good conversations, thinking about everything from A to Z. Anything that we left out?
I would probably also teach him how to like what symptoms to look for in the event that it would happen again.
Got
That's
it.
like that's the reason why he might have postponed going to the hospital anyway. He doesn't know what the symptoms of a heart attack are.
Good. What else?
Make
What
sure
else?
his discharge papers are in Spanish.
Got it. Good. What else? Anything else that we didn't cover, mention, or we were not
Make sure
clear on?
that he understands that he can return at any point, even though he doesn't have health insurance coverage.
Got it. Yes.
And follow up with the cardiology and or primary healthcare provider.
Okay. And he might not even have a primary healthcare provider. So that might be a conversation too that we might need to start before leaving so that he can identify. And I think somebody said follow up, but yes, because if he hasn't been going, I think the wife or something said something about 2 years. And so we might have to help them pick out one because a lot of the hospitals do have the physicians that you see there, they'll take you on as a patient. So good. Okay. Anything else that we didn't mention or we just need to, re-mention before we go to our break?
Practicing safety measures at work, because being in construction, you're exposed to things that, including stress, but also like chemical irritants and stuff that can further.
Clock.
Yeah.
I don't need to be calling your name.
Uh-oh, hold on. Remember, we are recorded, you all, and we don't want to hear or see anything that we shouldn't. So just make sure you're on mute before you talk. Okay, good. We kind of forgot about that, and I'm gonna mess it up because you told me had me to pronounce it at the beginning. Okay, you know what I'm trying to say.
I was gonna let you try it.
I know I'm not gonna mess it up, but she's right. We
You can
did
just say
that.
Ray.
What'd you say?
You can just call me Ray.
Okay, Ray. Good. We kind of forgot about the work, the stress, the job, the tasks that he has to do at his job. Oh my. Some jobs in certain settings that we work in, it is high stress. It requires a lot on the body, push, pull. Are you allowed to take breaks? Do your employee need to know, hey, you need to stop and take your medicine at certain times? He might even be on a where he's having to measure his blood pressures at certain times of the day and when he's doing certain things. So good. We kind of forgot about that. Great. Anything else that we didn't mention? So yes, you're providing that holistic care. We have to think about everything from A to Z for our patients, including that diagnosis. All of those things. Okay. All right. So we're going to pause here. It's 7:45. We'll see you in 5. Just as a reminder, these sessions are still recorded. So, but you can go off your camera, but just know this thing is still recorded. See you Uh-oh. All right, come on back. Come on back in. Okay. So let me go back to our case study. I think it was two more things I wanted to say about our patient. Well, okay. So I did want to mention our patient. So what do you think? I'm gonna ask the question. What do you think for immediate, if it was a MI, heart attack, myocardial infarction, what are some medications that immediately, more than likely would have been administered for that patient?
Nitroglycerin.
Morphine, oxygen, nitroglycerin, aspirin.
Nitroglycerin, oxygen, aspirin, and one other thing that they usually give.
Morphine.
Morphine. Yep, those are it. The oxygen, because you remember that heart tissue is dying. So we want to make sure that we're getting that nutrient, oxygen. That so he's going to need that extra oxygen. Plus, remember his O2 sat was low. That nitroglycerin, that morphine, and that aspirin. And so we don't know that they will take him, but more than likely, what procedure would they do?
EKG.
EKG. What else?
Possible
A heart
catheterization.
cath.
Heart cath. Yes. More than likely, you're gonna prepare the patient. If they haven't eaten or whatever, or even so, there's gonna be conversation about preparing that patient to go have a cardiac catheterization done. They may end up having to put stents in, they might not, but more than likely they're going to go and see, what is going on. Is there some plaque rupture there? What is causing these findings that we're getting? They have the abnormal EKG. The patient is the subjective information, the objective information. They're going to do further testing to see, and that cardiac catheterization is a procedure that they do to see what's going on with those vessels. Do they need to open them back up with those stents or not? And then we did talk about consulting case management and then social work. Let's see, what other thing? There is an Emergency Medical Treatment and Labor Act, which requires hospitals to stabilize patients regardless of insurance status. We said that, but there's that name of that act is Emergency Medical Treatment and Labor Act. So I forget who said that, but just you all said that, to let him know, hey, you can come. Don't hesitate. If you are not feeling well, you can go to that hospital and they should not turn you away. We talked about the interpreters, having the social worker prescription assistance program. I think we kind of talked about that, identifying other resources, but especially if they have to be on those specialized medicines, a lot of those pharmaceutical companies, they have those prescription assistance programs. And then some certain pharmacies do have them as well, but that's a resource. And I think we got it all. Let's see here. Yep, I think we covered everything. Yep, that was it. That was all for that. Now, I did place another case study in your box. in Canvas, but of course, we've only taken one break. We still have 15 plus our 5 minute break that you all are due. So you are free to go at this time, but know that there's a case study in your box, and that's what we'll start with when we come back next week. We have next week, and we have 2 weeks before we have our next exam. So feel free to reach out if you're needing that one-on-one tutor, if you have a question about a concept or something. But no, exam grades will be posted after the last class take their exam on Friday, and after we have that exam analysis. All right, take care, and we'll see you next week.
I thought I was talking the whole time and I was on mute.
I saw you talking about it. I was like, well, I don't know if she's really talking to me or not. Is it something I need to stop the recording for? I'm just